Well, I lied. It was less than 30 seconds. We're going to get rolling here. Great to see everybody. How's everybody doing tonight? Glad it's not raining out there right now. We certainly have had plenty of it. How about those Royals, huh? Still playing well. Hopefully the season goes that way. Welcome to the Kansas City Woodworkers Guild monthly membership meeting. It's nice to see everybody. I wanted to welcome any first-time visitors do we have? Do we have any first-time visitors here tonight? Anybody coming to see us? All right. Thanks for coming out and seeing us. Do we have any brand new members? Anybody joining this your first time tonight after joining? Not you, John. New member? All right, thank you. I think we all will admit we have a pretty great group here, and nice to have you as a member, and hope to see you around the shop all the time. Welcome those of you that are streaming on Facebook or YouTube or any other platform. I think those are the main two, so nice to have you as well. You all know me pretty well. I like to buzz through this business meeting as fast as I can. So if I skip over something, stop me. But we're going to keep things rolling. I don't have anything special to report. I think that if you all read the newsletter, I would say keep recommending the guild out to your friends. You find someone who's interested in woodworking, let them know, bring them down, show them how great it is to come down. And how we would love to have them as members and join, and we all can learn from each other and just have a nice bit of camaraderie. And so keep recommending and try to find new members. We're always interested in people coming down. So Ron Hall, do you have anything to report? I know we're going to talk about the safety update. Ron? You didn't do anything? Well, come on. Do you have a report or? Nothing as a vice president. David, anything special report from the secretary?
Nothing to report.
All right, nothing from David. John Steyer, anything to report, John? We're still we're in the black. We still are able to pay our bills. So that's a good report. Hopefully that stays that way. We appreciate everybody's participation in helping us do that. Craig, do you want to give us an update on the first Friday, or we're going to do that We'll cover that under events. Okay, great. All right, yeah, this is moving really well. Chuck and assets, anything special? Are you selling anything tonight over there? Nothing. I would say, and I know it's a team effort, but Chuck has been leading. I think his shop is looking great. So thank you for all your work. And I had my mom and dad in town this weekend. They flew in from North Carolina to go to. My son graduated from college, so we drove down to Fayetteville, Arkansas. He graduated from University of Arkansas, but woo pig suey. The good part, best part about that is I'm done paying for college. I got 2 out. But you all know my dad is a professional woodworker, and he's visited the guild several times over the years. So I was pretty proud to show him around, and when he was thinking of the old location to this location, he was kind of blown away. So well done, everybody. All right, I got a little off track by talking about myself here. Brian Rohrbaugh, anything special to talk about from the communications? I know Brian's here. No. Nothing special to report. The newsletter, nice job on the newsletter, Ron. And did you have help this month, or is it just you? So Steve. I'll thank you, Ron. I will repeat that for those that maybe were online or couldn't hear. Ron and his team have done a great job, and he's going to be transitioning over the next 6 to 12 months to Ron Robaugh. I may have mispronounced that. Well, we have a volunteer that's going to help us out, and Ron, if you're out there, we really appreciate it. And what I will reiterate what Ron Hall said. We really could use your articles if you're visiting somewhere and you see something that you think the members would enjoy, whether it's architecture or woodworking or just something of interest or a project you're working on. We'd love to see an article. And I agree, no one wants to always read from me and Ron and John Steyer, although we're going to continue to do that. We would love to see articles from you all. So thank you for considering that. Next thing down the line, Don Steele, do you have books for sale tonight? Magazines, 5 for $1, 25 cents each, 5 for $1. Books, you have any books tonight? No books tonight, but those magazines are really good for for nighttime reading. If you guys are interested, help us pass those on, because there used to be a day where those are really coveted. Now they're there for the taking. Want to remind everybody to keep checking us out on Facebook. We have a Facebook page and a Facebook group. I saw that there was activity going on this week about people taking classes and building projects and all those things. You can also check us out on Instagram. If you do your work, feel free to tag the guild. Post early and often. Try to get some engagement out there, and I appreciate all of you guys that do that. So if you haven't checked us out, you can always go to those pages and see what's going on. I typically try to tag the guild on my work, but I haven't posted anything for a while because I haven't done much woodworking in the last couple of months. I have been working on a bathroom remodel though, but so I haven't been doing nothing. Hasn't been much woodworking involved. We're up to 445 subscribers on our YouTube page right now, so if you haven't subscribed, please do that and check out some of the videos. We have our skill builders on our web page. We have our monthly meetings, so check it out. Chris McCauley, any announcements from AV or events? So you want to come give us a First Friday update with our second one just recently had?
All right, I'm Katherine. I'm the chair of the First Friday committee, and the committee has some amazing women and men on it who do really amazing work. So I'm only speaking on their behalf of people who are doing really cool things. Oh, is that better? Do you got my good side? So our second event went really well, 65% increase in sales. Awesome. So that brought our sales to over $1,000 in one night, and 80% of that goes to members. So if you haven't sold with us yet, come sell with us, okay? We really need all your amazing work. And the reason our sales went up so well is because of all the volunteers who came out. So if you haven't come volunteered with us yet, please do. Y'all had me worried last month. Like, the sign up was really bad and I was scared, and then y'all came out of the woodwork. All I need you to do is just literally, seriously. But y'all came out and you showed up, and the people down at the booth who are in the Crossroads proper and direct people up here, you guys are the reason we had foot traffic. So if you are a person who doesn't mind saying hi and directing people up here, please do that. We really need you. And if you want to be up here giving tours, a lot of you foremen and forewomen out there, you did give a really great tour. You just didn't sign up first. So sign up, right? Other than that, you guys,
Good job. Thanks, Katherine. We have, we're 740 members. So let's keep pushing. Let's get over to 750 before next meeting. How about that? Four new members from our events. That's awesome. Great job. So, Matt Nowak, in programs, I know we have a program tonight. Dr. Katherine Gunn is here. We look forward to that. Any other announcements from programs? Okay. And then safety. Ron, you were going to give us a safety update. Come on up and use the microphone.
Okay, Steve Hicks, who's our new safety director, wasn't able to be here tonight. He had a plan with his wife, and apparently he thought that was more important than being here. So, if you don't know Steve recently retired from Evergy as one of their safety directors there, and he's a pretty neat guy. He read his article in the newsletter. Does a great job writing. And once you meet him, you really like him. He's a super guy. Last night we had our first safety committee meeting that we've had in quite some time. And one of the things that Steve wanted us to talk about was that we're needing some volunteers to, number one, join the safety committee, participate in that. And we're also looking for some guys, especially some of you guys have been around for a while, to do some of the orientation meetings. The way those work is it's about 2 to 2.5 hours. 1 month, which I believe was this last month, was a Saturday. Is that right? Next month it'll be on Sunday. Following month it'll be on Saturday again, and they alternate back and forth. We usually like to have 2 guys there. One guy primarily runs the meeting in the room where we introduce everybody. We have a video that we show them as our slideshow. We correct their tests. And then everybody that is attending the safety meeting does a walkthrough in the shop where you learn, or you not necessarily learn, but you get to see of all the equipment that's in the shop that we have, give you a little bit of background on that equipment, and let you ask any questions you might have. So if you're interested in that, see me, see John Sloss, he's a member. Ron, where's Ron? He's over here also. And but see one of us if you'd like to participate in any of that. We would like to get a few more guys on that committee. We're also going to start back up with the safety videos. We haven't done one in about 1.5 years, or maybe it's even been 2 years now. We still have about 6 pieces of equipment, I think, to do. I know we have the router tables, we have miter saws, panel saws done. And table saws has to be done. Those videos usually we typically do them we shoot the videos on a Friday morning. Typically takes 2 or 3 hours, but we're always looking for somebody who's willing to be the spokesman for those videos. If you've looked at them online, we try and make sure that we cover the information that's in the tests that the new members have to take. And it's pretty painless. We script them out pretty far. We try and we try and do them pretty well. We try and keep them pretty tight, but that you come away with that. They're not terribly long. They usually, by the time it's all done, they're usually about 4 or 5 minutes. So, if you'd be willing to be an on-camera personality in that, we'd certainly like to have you do that. Let's see, I'm going from notes here. Okay, the safety videos, the next orientation, John Sloss and Ed Stewart are doing on June 9th. So if you'd like to do that, you can, if you'd like to come in and participate in the meeting, at least sit in the back room, kind of get an idea as if you'd like to do that. Or maybe pick one up later on going down the road. We'd certainly like you to show up and do that. The other thing we're getting ready to do is The safety book, and those are posted around the shop. I think there's 2 or 3 versions of that are posted in various parts of the shop. Those need to be updated, and I think we've probably got 5 or 6 pieces of gear now that need to be added to that safety book. Those rules need to be written and gone over by the committee, and then we'll get them printed and added to the book, the books that we have now. So something that, again, if you've got any writing skills, we'd certainly like you to do that. And we could use 2 or 3 more people to help give us a hand. Last thing I want to talk about, if you remember about 3 years ago, we had an eye surgeon over here from KU Med. We have another guest here tonight who's going to talk more about that. But one of the things is safety glasses. I'm still seeing a lot of guys when I'm foreman who are still wearing their regular normal glasses, the safety glasses. You know, at a point in time, we're going to ask you to go home if you're doing that. You've got to wear approved safety glasses with side shields. You know, set them up on top of your head, just wearing safety glasses. You know, I remember that Dr. Bashir, when she was here, one of the worst injuries she said she had seen was a guy walking through a shop somewhere who got injured in the eye because he was walking from an office to a back room or something and wasn't wearing glasses. So, you know, we're pretty lucky as a group here. We try and watch. We don't have very many or hardly any injuries ever. But it's something that you really need to take this more seriously than you do sometimes. So I think, you know, it's one of the things you really want to pay attention to. And I don't want to be the guy to ask you to go home. That's embarrassing for me, and it's certainly going to be embarrassing for you. But you've got to make sure, please, that you're doing that, because we don't want to see somebody get hurt. And on that note, I think I'm done.
All right, thank you, Ron. We've got a few more. Good job, Ron. Rough to ready. Lots of classes are available, so check the website. Anything else to talk about, John? Sponsorship, Dwayne. We have raffle over there. Do you have announcements tonight? We got 5 items to raffle. There's a. Yeah, absolutely. The router table, is that what that is? Sweet. That's for next month, so get ready, everyone. Exciting. But yeah, please go over and participate in our raffle. Training, Rich, you're here. Do you want to come talk through training? Come on up. A lot of good opportunities for training and classes.
We do. We have a lot of opportunities. I do want to just point out a couple things. First, skill builders. We will not have a June skill builder, but July we're going to have a skill builder on pyrography with Barb Akers. That's going to be July 6th, so mark your calendars for that. And then a couple classes that are still open. We have on June 11th through 13th, we have a finishing class that still has a few slots left open. So if you're looking to take that finishing class, that's a good opportunity for you. And then I also, on June 29th, we're going to be offering a bandsaw puzzle class. And that is going to announce really soon. I think even like next Tuesday. So keep checking your emails for that if you're interested in that. That's it for now.
Okay, awesome. Thanks, Rich. So now we're at the point where we talk about our SIGs, which are our special interest groups, and I'm going to run through those really quick. So first is the hand tool SIG that meets the fourth Sunday of the month from 2 to 4. So May 26th is the next one. Does anyone know what the next focus is? We can always show up and they will talk hand tools. I don't see Rob or Wayne. The Woodcarver SIG next meeting is May 28th. They meet the fourth Tuesday of the month from 6 to 8. Dan, do you have any, do you want me to do your standard? Fourth Tuesday of the month. May 28th. May the 28th, which is almost 2 weeks from now. And I will say, if you're interested in carving, come down. You've got some great, there's power carving, there's traditional carving, there's folk carving, whether any type of carving, bring it down. These are the guys that help you out with techniques, tools, sharpening skills, all that stuff, right? Okay. Scroll Saw Sig next meeting is June 12th, and they meet the second Wednesday of the month at 7. Any announcements from other than that, George? Okay. Come on down if you're interested in Scroll Saw. They're the guys that get you started if you're interested in that at all. CNC Group, the next meeting is May 21st. That's led by Gary Milkey and Ed Stewart. They meet every third Tuesday of the month from 6:30 to 7:30. I don't know if there's anything additional to report. And I skipped over, I did not mean to, Laser Engravers meet May 22nd, fourth Wednesday of the month at 7. Curtis, I saw you were here. Anything specific? Okay, so Craig's going to present in that meeting on the 22nd, and that's the place to get trained as well, because after the SIGs they do training. So great opportunity to get involved there. We did pretty well. We're through the business side. We're going to mix up the order a little bit tonight because we are out of respect for our presenter, but we have Dr. Katherine Gunn here, who's going to come talk about shop safety, and I'm ready for her to come on up and take away the.
Thanks. Where do you want me at? Back here? Okay.
Oh, you've already.
I have one.
You're already.
Yeah, thanks. Hello, everyone. Thank you for having me tonight. My name is Dr. Katherine Gunn. I'm an optometrist with Family Eye Care Center, and we're based out of Lansing and Leavenworth area. But if we can bring my slides up, I'd love that. Okay. So again, this is a little talk about eye health and safety. So we're going to do a little bit of safety talk and then also a little bit of just general eye health. Oh, I have to turn it on. That would help. Okay, just a quick little introduction about me. I went to Washburn University in Topeka, Kansas, and then I got my doctorate of optometry at Southern College of Optometry. Some of you may know the difference between optometrists and ophthalmologists, but I'll give a quick little rundown first. So optometrists go to 4 years of optometry school, and then they can do an optional 1-year residency and then go into practice, whereas ophthalmologists go to 4 years of medical school, and then they go to 4 years of a residency program in ophthalmology, and then they can do an extra fellowship in ophthalmology as well. So ophthalmologists are big surgery people, whereas optometrists are kind of primary health care. So refraction is how you get your glasses or your contact lenses, and kind of similar to where your primary care is the first route for you guys to go to for any other kind of specialist. We're kind of like that for the eyes. So you usually see us first, and then if you need to, then you can go on to an ophthalmologist, but some of you may see an ophthalmologist primarily. So I'm from Kansas. Again, I work at Family Eye Care Center, so we've got 4 practices, one in Leavenworth, one in Lansing, one in Bonner Springs, and then one up in KCK. I'm primarily at the Lansing office, and we kind of specialize a little bit more in dry eye at that office there. So that's just a little bit about me. Do I have to point it anywhere in general? Okay, so a quick agenda here first. So we'll go over general eye anatomy, just so you guys have an idea of where these structures are in the eye. And then we will do, it switched to me, sorry. I don't know what my agenda is. So then we'll go on to common eye injuries that we can see in woodworking. Then we'll talk about the ANSI standards as far as safety glasses go. So that's kind of a nice little segue for me. And then we'll go into just kind of common eye health concerns, things that you guys may have questions about, and then we can also do questions at the end. So as far as anatomy goes, I kind of think about it in external and then internal portions. And so when we think about, I got my little laser pointer here, it's really tiny. But anyway, when you look at someone, you're gonna, cool. So when you think about what you see on a person, you'll see that kind of in this first one here on that very top one. So the pupil is actually just a hole, so it's that black thing right in the center there. So the reason it's black is because our eye is not backlit, so there's no light to come out of the eye, okay? When we think about the iris, that's the colored portion of your eye, and your iris is a muscle, and so it moves back and forth, and that's what makes your pupil bigger or smaller. When you go to see an eye doctor and they dilate your eyes, they're actually working on that muscle of the iris versus the pupil itself. So the pupil is just kind of the hole in the middle, okay? The reason we need to dilate you is so that we can look at the structures within the eye, because if we're not doing that, it's kind of like you're just looking through a window versus opening the door into the room, okay? So I can only see a little portion if we don't dilate you, but if we do, then I can see the whole room, essentially. The reason we need to do that is we need to look into the eye to make sure there's no kind of holes or tears happening within the retina. So the retina is at the back of the eye here, and you can kind of see where it's pointing to, but it goes almost like 270 around the back of the eye. What the retina does is it moves light into images for us, okay? And so when we do that, those all travel through the optic nerve, yellow little line at the back there. And what that does is it sends images into our brain, so then we can see. The macula, where it's pointing to kind of centrally in the back there, is a really tiny little portion of the eye that's actually responsible for 90% of what we see. It's our kind of fine detail, whereas the rest of the retina is mostly for movement. At the front of the eye, we can see the clear dome is the cornea on top. Okay, so that's kind of encasing the eye there. We want that to be clear so that we can see out. If there's any kind of opacities anywhere in this system, then you're not going to be able to see. Behind the cornea and behind the iris is the lens, which is that kind of little circle right there. And what that does is it moves back and forth so that we can focus. So at some point, we all lose that ability to focus up close. That's why we need reading glasses at some point. That's our lens's fault, okay? Everybody loses that ability. I don't care who you are, you're gonna have to wear readers at some point. And that's just the reason why. Now, cataracts also happen in that lens there, and we'll talk about that a little bit more later. But then the kind of last two things, there's overlying structures over the white portion of your eye. The white portion is called your sclera, and there's kind of a little encasing that's over that sclera that's also tissue, and that's called the conjunctiva, and that's what can get really red. Like if you have a red eye, that's where that happens. Last thing is the vitreous, so that's the jelly within the eye there. So if you kind of see there's just a clear space in that big circle. So what that is it's just kind of a jelly that keeps the eye the shape that it needs to be. Now if you have floaters, that's where that comes from. So that vitreous is made out of collagen for the most part, and sometimes those collagen fibers can get stuck together and then cast a shadow within the eye. Any questions about eye anatomy itself? Okay, these next slides are actual pictures of eyes, so if you're a little bit squeamish, you can go ahead and look down towards the floor. I promise there's no blood, it's just photos, but I thought I'd give you a little warning. So kind of four big kind of more common injuries found in woodworking. The big one would be a corneal foreign body. So in this picture, I tried to make them small so if you were squeamish, you didn't have to look at them. But you might be able to see that small little brown piece that's kind of in the center there. And so that's a piece of wood that got shot into someone's eye there and is lodged in the cornea itself. So remember that clear dome. That one would be, we need to probably take that out with some kind of forceps. It would probably leave a gash afterwards, so where we'd need to put different antibiotics or even steroids on there. The big worry in this situation is one, that it would perforate the cornea, and that means it would go all the way through. That would make you need to have surgery, okay? If it's not totally through, then that can be taken out in office. The other thing would be scarring afterwards. So if you get a scar on your cornea, it's really hard to get that to go away, and then your vision will be pretty blurry afterwards. So that's why it's important to, if you ever feel like you might have something in your eye, go see an eye care professional so that they can assess and take care of it and get you on any kind of medications to decrease scarring, okay? The next one, kind of up into your guys' right, would be a foreign body under the lid. And so this is a picture of someone who has flipped their top lid and a little piece of wood is stuck under there. Now that you would feel every single time you blinked, it would cause like a little scratch every single time. And so that one, even if you flipped your lid, you might not be able to see that. All of these are really zoomed in with a special microscope so that we can see these things. So you could flip all day and say, I don't see anything, but I still feel something. This one's a little bit easier to take out. Usually I just use a cotton swab and just nick it out, and there's not really anything left over besides the scratches. You know, your cornea heals super fast. It heals within 24 hours, so if you have a really superficial scratch, nothing's really gonna be too bad about that. It's when we get into these kind of deeper penetrations that we have an issue. Now, when we go down to the left over here, that's a chemical burn, so that's if you got something, some kind of splash back in your eye, whether that's varnish or something else, some kind of acid or base, okay? And here, it's a little bit tough to see, but on the very right side of that cornea, you can see that it's starting to get a little bit hazy, and that's because of that acid or base reaction that's happening on that cornea. You can tell on the top cornea, on the corneal foreign body, there's no haze that's happening there, which is good. Once we get to a chemical burn, there's really not too much that we can do about that scarring. We can try and put steroids on it, but it's gonna scar. If it goes over the pupil, so that, again, dark hole there, you're not gonna be able to see out of that eye, and you could potentially need a corneal transplant at that point. So chemical burns are quite a bit tougher in that situation. The last thing that I'll talk about is a traumatic cataract, and so if you can see within the pupil there, so behind the iris, remember, is that lens. If someone has some type of blunt force trauma to the eye, then that can cause a traumatic cataract. So the cataract itself is just those little white lines that you see. You can see in these other two pictures where you see the pupil that it's totally dark. We don't want to be able to see anything there so that we can see out of the eye, okay? So that's what that kind of type of cataract looks like. There's lots of different types of cataracts, but that's one in general. Just an anecdote from me, I haven't had any woodworking issues, which is great, I love that. But I did have a woman who came in who had gotten shot point blank with a Nerf gun, and she had a traumatic cataract afterwards. So wear your safety glasses even when you're playing with kids, so they'll get you. Any questions about any of that? No, great. Yeah? Does everybody get cataracts? Yes, great question. Everybody does. Yep, if we're lucky enough, we will all get one, and we'll talk about that a little bit later too. So, great question. Yeah.
Have you run across cases where people have gotten super glue or epoxy glue in their eyes?
Sure. I haven't particularly, no, and the question was about if we've gotten epoxy glue or any kind of glue in the eye. No, but the biggest thing that I would tell you to do is rinse at that point, just to try and get everything out. And I think that's on. You guys are just too good at guessing what I'm going to say next. So what to do if something like this happens, or if you get anything within the eye. Rinsing is the #1 thing, okay? Because then you can try and get whatever's in there out. You're on your own. So using some type of sterile saline or even water. Water isn't my favorite thing because there are other bacteria that can be within tap water. So sterile saline is great. In this, I'm over it now, but there's a little picture of like a little bottle of saline that you can get at the store, where you can just hold it on your eye and you squeeze and it'll flush. It's recommended for 15 minutes. That's a long time to be flushing something, but especially if it's a chemical, you need that time and that flow of water or sterile saline to get through to wash as much as possible out of there. If whatever foreign body is in there isn't lodged, it's going to be pretty easy to flush it out if you can on your own. So you can try that out. Now, not everything is going to want to come out. So in the meantime, before you contact your primary eye care provider, you can use just regular artificial tears, something that doesn't have preservatives in it, because you're going to want to do that tear every 30 minutes to an hour until you see someone. Again, just to kind of act as a little bandage for you, and just to kind of smooth over that top layer or that cornea there. So I say preservative free because if you use a regular bottle of tears, those are always preserved with something, and they're not recommended to use more than 4 times a day. Okay, so preservative free, you can use as many times throughout the day as you need to. The only caveat is that you have to throw that vial away within 24 hours of it being open. You can open up that vial, use it as many times, recap it, but you just have to throw it away after 24 hours. Otherwise, there can be bacteria that can grow in that single vial because there's no preservatives to keep them out of there. Questions about any of that? Did I answer your question there? Okay.
For years, I've been taught as a woodworker, when you get dust in your eye, which happens a lot
Sure.
when you're working on wood, you get sawdust in your eyes, that you get something in your left eye, you rub your right eye, and that makes the both eyes.
Tear,
When
essentially.
it comes to flushing, though, I guess the opposite is true. You would flush whatever eye you got it in there, right?
Correct, yeah.
But am I hearing that right, to rub the opposite eye if you get something
You
in your
know,
eye?
I've never heard that before. Potentially, it could just cause another reaction for that eye to want to tear over
Well,
there.
You don't want to get.
You don't want to
scratch
rub
your
that eye
eye,
that
so,
something's
yeah,
in
you
there.
rub
Right,
the
I do
opposite
like
eye.
that.
That's
Yeah,
what-
I like
that's
us
what I've
not
been
rubbing
taught.
that eye that
Yeah.
something's in there with. Yeah. Potentially, it's just a reflex reaction of you rubbing this eye. It makes both eyes tear, and so then those tears are trying to wash that out. But your regular kind of reflex tears aren't going to be enough to get too much out of there. If it's just a tiny little bit of dust, maybe. But you're definitely going to want something external to flush. Yeah. Yeah, don't rub the one that something's in. Great. Any other questions? Yeah.
On a lot of these saline solutions, like buy a bigger bottle and keep it
Sure.
on hand, is there a typical shelf life for that kind of
Good
stuff?
question. They will have an expiration date on there. So I would assume it's probably a 5-year span. That's at least like contact lens solution and contact lenses. What's good there? I mean, if it's unsealed, or if it is sealed, it should stay for quite a while. It's kind of like, you know, water bottles. Water bottles expire. It's because the plastic expires. So it's probably a similar situation. Yeah.
Okay, so if I have a family member that has contacts, odds are, if I really needed to, I could run to the bathroom and get the
If you
saline
needed to,
bottle.
you can use one of those for sure. The only caveat with that is that there's cleaning materials in the contact lens solution that might sting your eye, especially if they have a red cap. If anything has a red cap, we're not going to put it directly in our eye. Red means warning. A lot of the time, red cap contact lens solutions are hydrogen peroxide based, and if you put that in your eye, it's going to sting really bad. So yes, anything besides a red cap, you know, a regular contact lens solution, if that's all, then that's great.
More questions? Anyone?
No.
Twice, but just a bottle of saline solution from CVS, keep it in your wood shop, start squirting it in your eye if you get something in it.
Sure. Yep. The one thing about the one that I put on here is it has a specialized eye cup on there so that it'll try and keep as much of the solution in as possible. There's different types around, but the benefit of having the cup is that it kind of tries to keep things solidified in a certain area versus you just blindly trying to shoot it in there.
There's all kinds of tricky stuff on Amazon.
Sure, yeah. And that's a big thing too, especially at the beginning of this year, there were a lot of recalls on store brand artificial tears, and that was because the manufacturing companies that were doing these tears, they were actually, you know, getting bacteria into those artificial tears, and people were getting infections, and some people even lost their eyes, and some people even lost their life. So it was a really big thing just from an artificial tear. So making sure that you have name brand, any kind of solution or anything, those name brand have to go through certain qualifications to be able to sell. So whereas store brands, not so much.
Yeah, when I worked as a paramedic, we found out that if people tried splashing and spending large quantities over their eye at a time, that they would blink and they'd close their eyes tight. But if you can find a way to do a slow, steady stream, you're more likely to get the fluid into the eye and do good.
Exactly, yeah. If you're your eyes are meant to keep things out, not put things in. I tell that to people all the time, especially people that are trying to learn how to put contact lenses in. It's just a reflex. Anytime something's coming fast towards your eye, you're gonna wanna blink really hard and shut those eyes. So something that's a little bit slower is gonna be really nice. Yeah, that's a great point. Any other questions? Okay, great questions. Okay, so now we'll talk about ANSI standards. And so I even had to look up and remember what ANSI stands for because I learned about this in school and then totally forgot about it, like most of us might do. So it's the American National Standards Institute. Now, why is this important? It's important because we need to know that the safety gear that we're using actually holds up to any kind of values and that it's been tested to not break and to not shatter into our eyes. So the ANSI standard 87.1 is for safety glasses, and the what it kind of goes through is the big two that any kind of ANSI standard 87.1 is going to have is impact resistance and heat resistance. Now that impact resistance, the regular Z87 is just a drop ball test, and what that means is that it's a ball about this big that they drop from 50 inches and just drop it and let it hit, and the lens can't crack and the frame can't crack. That's not very high impact, okay? The stuff that you guys are working with is a lot faster. So a Z87 plus, when it has a little plus sign at the end, means that it has to go through a lot higher impact standards, and it actually goes through a velocity testing. And so that velocity is actually a pointed projectile that's shot at 100 miles per hour, and the frame can't crack and the lens can't crack, okay? So that was something that I would look for in any of your safety glasses. Have a plus sign on there just because it's going to be quite a bit safer for you guys to use especially. Chemical or liquid splash, dust and radiation, those are all kind of separate requirements, and so that's why I put this picture up here, is because these are kind of some goggles that have some dust resistance there. So the ones that you're going to want to look for if you're looking for liquid splash, that's going to be a D3 next to the Z87. For dust resistance, it's going to be a D4, and those ones, D4s are usually ventilated so that things can still move around. Fine dust, that's going to have to be up to a D5, and that will be non-ventilated, okay? So it's going to keep everything kind of stuck in there. Those standards are going to be either on a goggle on the top or on your lens kind of at the back temple back here, okay? So those are always things that you can look for. See, you said I got them right here. So those are kind of big things for you to look for especially. So any questions about ANSI standards? No? Great. Okay. Almost done. So these are just kind of common eye health concerns. So these are things that you may bring up to your optometrist or ophthalmologist, or they may bring up to you at every yearly eye exam. So again, cataracts, everybody's going to get cataracts at some point. Doesn't matter who we are, it's just a matter of how lucky we are if we get to that age. A big proponent of cataracts is sun exposure, and so if you had a lot of sun exposure, then you might get cataracts a little bit earlier than somebody else. Our diabetics will also get cataracts a little bit earlier just because of those blood sugar swings. So when we're born, our lens is nice and clear like we can see here, and then all a cataract is just the clouding of that natural lens of our eye. And so that's what makes things either blurry all the time, or halos around lights is a big one too. Then we can go on to macular degeneration here. So this is a picture within the eye. So we can see the optic nerve as that kind of central circle there. All the little squiggly lines are blood vessels. And then in the center where it's a little bit darker and where we can see all of those little yellow dots, that's the macula. We don't want those yellow dots there. That's macular degeneration. All macular degeneration is again, it takes a lot of energy to transfer light into images for us, and there's a lot of byproduct from that. So our retina should be able to take that byproduct and move it away, and so it gets processed. And people with macular degeneration, that byproduct builds up, okay? And that can cause central vision loss or just kind of blurring of our central vision. You might have heard of the two different types, so there's dry and there's wet. Dry is what we're seeing here. That's just the buildup. And then wet is when there's blood associated with that buildup. Okay, some people might have to get injections into their eye to mitigate that blood buildup. Glaucoma it affects the optic nerve of our eye, and so it can start by just kind of crushing the nerve essentially, and that's because there's a buildup of pressure within the eye. That's that eye puff test that everybody hates, but nobody really does the eye puff test anymore. There's different tests that are a little bit less invasive and actually get better readings. And so that's what we're looking for. We're trying to see if you're at risk for glaucoma because of how high your eye pressure is. Glaucoma affects your side vision, so it'll start with just kind of side vision loss, and then if it gets really bad, it'll go centrally here, and you might only be left with just a little bit of your central vision. Last thing is dry eye, and so again, I'm a big dry eye person, so I always have to throw it in here as a little plug for myself. So there's two types of dry eye. So either you're not making enough tears, or the tears that you do make aren't a good quality and they're not sticking on your eye. Most people have a quality issue versus a production issue. So if you're someone who you're sitting around and you wake up in the morning and your tears are running down your face and you're like, oh, what am I doing? That's actually dry eye, and I know it sounds so backwards to tell you that, but what happens is that our eye tells our brain that it's dry. Our brain floods our eye with tears, but they're not good tears that stick around. So that oil layer has to deal with the oil glands of our eyelids and the bottom and then on the top, and that oil can get stuck in those lids and not come out and coat the tears very well. So dry eye has a lot of blurry vision, a lot of irritation, redness, tears running down the face. So something I always tell people is even if you see well, it doesn't mean that your eyes are as healthy as they could possibly be. There's no way for you to know any of these things are happening to you. So that's why it's important to see an eye care professional yearly. Any questions about just general health? Yes?
I know I'm not unique in this, but I have CPAPs, and I can't get the damn thing to quit leaking.
It's awful.
And it quite often blows right on my eye.
Yep.
And it wake up in the morning and it is dry.
Yeah, and that's a really hard thing for our CPAP wearers. So I usually tell my patients wear or put a gel tear in at nighttime. That's just a little bit thicker. There's also an ointment that you can get, but it makes your vision super blurry. So I say start with the gel, see how that goes. If that doesn't help enough, then you can move to an ointment. There's also a next step besides just the gel is there's special little patches that you can get to seal the eyes shut at nighttime so no air can be forced up there, but that's another thing on your face that you might not really like. So yeah, try that out. See how it does.
You mentioned at the start that everybody's going to need readers, right, eventually. Is there a surgery that can adjust that?
Sure.
So you don't need readers?
Sure. So kind of the big two that you may have heard about are LASIK and then cataract surgery. So in a LASIK procedure, what they would do is they would make one eye your distance eye and one eye your near eye, so you kind of lose your binocular vision in that aspect. There is cataract surgery. You can do cataract surgery even if you don't have a cataract, and they can put a special lens implant in. That is called a multifocal implant, and what that does is try and help you see for both distance and up close. Now, nothing's going to be perfect. Nobody's going to make anybody, 15 years old again to be able to focus all the time, okay? Contact lenses are also an option. Readers, and there's newer drops that are out now that are made to, what they actually do is make your pupil smaller, and so that helps act kind of like a pinhole effect so that you can see up close for a couple hours. Now those ones cause quite a bit of headaches, and they only work for people who only need like a plus 150 reader. So most people, once we get past 55 and 60, we need a 2 or a 250, so it's only helping so much. Okay?
Thanks.
Yeah.
So if you gave me the warm, the mask.
Mm-hmm.
That is so cool.
Yay.
And,
I'm glad you're using it.
I use it twice a day. But should I also be massaging those?
Those glands.
Those
what
oil
I usually
glands?
tell people to do is after we do any kind of warm compress, so what Matt's talking about is he's using a mask to warm up those oil glands to make that oil move a little bit better. So if we just warm it up, then that's great. And if we blink, we can move it ourselves, but sometimes we need a little bit of help. So sometimes what I'll tell people to do is after a warm compress is do kind of either a massage on the bottom or on the top, or just roll upwards or downwards, and that'll help move that oil out a little bit more.
I'm also curious about the cataract surgery. you actually replace the lens, and so you could see then.
Yeah, so in those 4 that I talked about, cataracts are the only thing that are curable, okay? So macular degeneration, glaucoma, and dry eye you're gonna have for the rest of your life. Whereas cataracts, they can take that cloudy lens out and they will put a silicone implant in so that it's adjusted for your prescription so that you can either see distance or up close or a multifocal lens so you can try and get both.
Is that a natural lens or is that an artificial?
Artificial lens, yep, and that lens will stick with you for the rest of your life.
I have a kind of a, well, maybe a little strange question. Whenever I go to the eye doctor, they always dilate my eye. And I always ask, it takes hours for that to relax. Why can't you put something in there to make it quicker?
Good question.
It sounded like that drop would do that.
Yes, that was one that they used for a while, but there are risks of retinal detachment with doing that because when it brings
Don't want that.
Yeah, when it brings the iris back down, that muscle is pulling on the retina as well. If you have any tiny little hole there and it's pulling down, it's going to pull that retina with it. There's one that's coming out now that's supposed to be a little bit safer, but better safe than sorry. Just take a couple hours where it's not very fun to deal with. Yes.
As you age, and if you have like the LASIK surgery or the, what are they called, the cataracts?
PRK or, yeah.
Okay. When you get those replaced, are your eyes still going to age? And will that vision change like in 15 or 20 years?
Sure.
Or will it be the same as you just got your surgery done?
Right. LASIK-wise, things are going to change. If you get LASIK when you're in your 20s and then you get into your 40s, you're still going to need readers. Okay, unless they do that monovision surgery off the bat, which they don't really do for 20-year-olds. As far as cataract surgery goes, the lens is made to stay the way it is, and that eye shouldn't change too much afterwards. Now, there's always little wiggle room here or there, but cataract surgery is more permanent, whereas LASIK, there can always be changes that happen there. Yeah, great question.
As one of the foremen, one of the things I'm concerned about is when do we decide this person needs to go to the ER versus waiting to go? When is it urgent?
Great question.
And also how we dress the wounds. Do you want bilateral dressing of the wounds, or of the eyes to keep the eyes from moving? And do we want something that actually doesn't touch the eye to go over the top of it?
So as far as where to go, oh my gosh, I'm so sorry. Where to go in certain situations. If there is something that you can see sticking into the eye and it is coming out, that's an emergency situation. That needs to go to the ER because that person needs surgery. As far as keeping the eye still, they just want to go to the ER is a big thing. They're probably going to keep it in the same spot. I do tell people to not pressure patch, and that just means to stick something directly onto the eye with pressure and tape associated, because sometimes that can shove things a little bit further. Also, it can cause different swelling if it's on there for too long. So usually I tell people, you know, just keep that eye closed over there, or wear just kind of like a pirate patch for a little bit that's not putting pressure on. Because if we shove something in a little bit too far, then that can make it a little bit tougher. So something sticking out, go to the ER. If you just feel like something got in there and you're blinking okay, the eye's moving okay, but you're in pain, go ahead and call your primary eye care provider. Most have on-call hours, so even if the office isn't open, there should be a doctor that can come and see you and take that out. If they see at that point that you need some type of surgery, they will get you to that point. A lot of the time, urgent care is great, but they don't have any kind of special equipment to look into the eye, so they'll either flush it or they'll give you an antibiotic and say, go see your eye doctor tomorrow. So you can always skip that step by calling your on-call doctor. Yeah. Did I answer enough of that? Was there? Yeah, okay. Yes.
What's the big deal about ARIDS 2, this pill that all the
Good question.
you guys
yeah.
are starting to recommend?
Sure. So as far as what ARIDS means, it's just a special component of eye vitamins that has been tested for people with macular degeneration. Now, when it comes to wanting to take the kind of vitamin, I tell people if you don't already have macular degeneration, there's no studies that say that it's helpful you getting macular degeneration down the road, okay? The studies only show that you have to have a certain point of macular degeneration for it to help. So it has to be, there's mild, moderate, severe. It has to be a moderate stage before those kind of eye vitamins will even help to prevent you from going to the severe stage or from converting from dry to wet. So it's not going to hurt anything if you take it. Some people will notice their contrast sensitivity is a little bit better with those certain eye vitamins. The two that are big are lutein and zeaxanthin. Those have carotenoids in them, which are just fancy words to say that it helps move all of that waste product out. Thank you. I was going to talk about that, and then I just breezed on past it.
This could very well not be a better question for the guild and you, but I'm new, so I don't know. As I'm 45, I'm probably going to need glasses soon or something. Do they make shop glasses that are prescription, or are all shop glasses big enough that they fit over glasses?
There's two, yeah. You can get prescription ones, or you can have prescription under, and then you can wear safety glasses over top. Either way, you can have a built-in. Yes.
Okay, I've got another question. We've got a laser back there that I use quite a bit, and it has an enclosure, and it's got that cover that protects your eyes and stuff. But there's air holes, and I'll be darned, I know that I look at that laser light through those air holes by mistake often. And I don't mean to. I always try and look away.
Yeah.
Laser burns. How dangerous is it?
Sure. It depends on the wavelength of the laser. So every laser has a different wavelength. So it's hard to say without.
Well, what is it that a laser burn does? What does the laser burn do?
Yeah, so either one of two things. It could cause a corneal burn. So have any of you guys welders too, or heard of welding burns? Yeah. So welding burns is like a flash burn. So it's pretty much just like the whole eye just gets real torn up. So kind of that can happen in a laser. If it were like pointed straight at you and you looked right in it for a couple minutes, it could burn your retina. But I think that would take some time for it to do.
Well, I think that enclosure does a pretty good job of protecting your eyes.
I would hope so.
Yeah, but I'm also, I'm tempted to wear the safety glasses as well as, but that's a little
So the
overkill.
big thing about that is that the safety glasses would need to be whatever wavelength that laser is. So any regular safety glass isn't going to filter that laser light. So it'd have to be specific for that laser.
Well, they say right on there, it's whatever that number was, that's 87.
Sure. And even if it says that number on there, it might not be whatever wavelength is that laser that's back there. Okay, so you just got to match those up. So if there's a special lens that works with that laser that the covering is, you might have to wear that. But just don't look in the holes, all right? Just
Okay, another question. Okay, I had a full face shield, and I was cutting out some metal on a grinder, and I'll be darned, one of those sparks flew up under the shield and hit me in the eye, and
it's awful. You can do everything right, and you can still get something in the eye.
Yeah.
So these
there
are
wasn't anything
precautions.
in the eye, it was just a spark that hit it.
Yeah.
And now that's a burn, but that's a different kind of burn. What would be, it fortunately just stung and went away, but if it had been bad, what should I have done?
Sure. So if you do get a spark to the eye, it's probably going to burn that cornea, and so that's just going to be dependent on how far in that goes to how much scarring you're going to have. So usually it'll kind of just be like if you had a scratch on the eye, if it's not too deep.
Yeah, that's what it was. It was just real. It hurt like hell for a minute.
I know. And the other thing too, your cornea has 300 times the amount of innervation as your skin. So you can feel so much more on your cornea than you can on your skin. That's why if you get even a piece of dust or something in your eye, you're going to know when it's there versus a piece of dust on your skin. You're not going to know. So everything hurts way worse in the eyeball. Yeah. So anyway, in that kind of situation, go see your eye care provider, and they can put you on antibiotics or a steroid to help that heal a little bit faster. Anything else? No? Okay, I have resources on here, so if you guys want to know where I got my pictures or anything, that's there for you. There's that. And then thanks. that was really it.
Okay. And also, all those resources is going to be in the YouTube description. So if you need to go back and look at those resources again, they will be in the YouTube description on the YouTube video.
Quick question.
Sure.
Do you take our card as a discount?
Oh, good question. You'll have to ask the office manager about that. I don't deal with that. I just see you.
Any other questions? Catherine, Doctor, you did an amazing job.
Well, thank you
so much.
Thank you guys for having me. I appreciate that.
So hold on a second. Well, it's not a lot, but it's pretty special. The only way you can get one of these coffee cups is to come present at the Guild.
Oh my gosh.
So thank you on
This
behalf
is
of the
the
Guild.
best.
And then who's going to come down and take our picture, because we have our mug shot.
Okay. Do I hold
Look
this?
at the camera. And there we have our mug shot. So thank you so much. All right, got
Perfect.
it.
Thank you.
Thanks a lot.
My husband's going to make me throw away one of my mugs so I can keep this one. But I'll do it.
So everyone, thank you again, Catherine. So I wanted to say a couple of minutes. So last month, everyone was kind of talking, and I kind of probably spoke more aggressively to get everyone to sit down and be quiet than I ever want to. So my apologies. I didn't mean for that to come off badly, because that's the last thing I want to do. And then also, so we're going to do a break now, and we're going to make the breaks a little bit longer, because it's a good thing that everyone wants to chat and get together. So we're going to do and we're going to come back and do show and tell, and we'll probably give you about 8 minutes. We'll say, hey, remind you that we've got about 4 minutes, and then about 10 minutes we'll say a couple minutes. So keep all that in mind and enjoy. So we're going to have a break now. Thanks, guys.
Your safety and the safety of all members when using any of the Kansas City Woodworkers Guild's hand or power tools is the #1 concern your safety committee and the board of directors of the Guild. Nearly every woodworking project will need to be sized and smoothed by one of the Guild's power surface planers. Currently, we have 2 planers in service and available for the membership to use. One is a 15-inch jet planer, and the other a 20-inch grizzly planer. Hi. My name is Christine Kessler, and welcome to the Kansas City Woodworkers Guild's ongoing series of machine safety videos. Today, we will cover the safety rules and requirements of the Guild's power surface planers and how to safely operate these machines. Keep in mind that this video is targeted to only cover the operational safety points of our power surface planers and is not designed to be a complete training program in the use of these machines. A power surface planer is used to smooth and dimension your lumber to the final thickness needed to construct your project. Both of the planers currently in the Guild inventory have helical cutting heads that smooth the top of any boards fed into the machine. Each of the machines have an adjustable table that raises and lowers to allow you to plane lumber, making multiple passes to a very accurate and specific thickness and smoothness. Remember, when you are in the shop, please direct any questions about using our planers and any of the other Guild equipment to the on-duty shop foreman. She or he is there to act as a vital resource to keep you safe, providing advice and assistance to successfully complete your project. While you are in the Kansas City Woodworkers Guild shop, you must wear OSHA-approved safety glasses with side shields at all times. Your regular glasses are not approved for use in any shop activity while you are at the Guild. The noise created in the operation of a surface planer might make you wear plugs or earmuffs. While not a safety requirement of the Guild, it is solely a personal decision. However, there is one caution on hearing protection. Our Guild's rules stipulate that any hearing protection worn by members must not have the ability to receive any type of broadcast media. Failure to follow this requirement may result in losing your shop privileges. Additionally, you should not wear any loose clothing or jewelry. Long hair should be tied back to prevent it from catching in the machine and drawing you into it, which can result in significant injury. Before surfacing any material on the thickness planer, the material must be flat and true on one face and not less than 12 inches in length. Flat material will have first been surfaced on a jointer or flattened by hand planing. A board not flattened and put through the planer will result in a board that is smooth, but that will mirror the warp, twist, cup, or bend to the other side of the board. You should examine your material and remove any loose knots from your board before planing so that they are not caught by the cutters and turned into projectiles when fed into the machine. Another solution to loose knots is that they may be locked into place by applying an epoxy resin to fill any gaps. However, application of epoxies will delay your planing operations until the epoxy completely cures. Any and all reclaimed lumber must be presented to the foreman on duty before machining to determine its suitability for use. It must also be thoroughly checked for any hidden nails or other metals with an approved metal detector. Treated green, yellow, or other ground contact lumber is banned from use at the Kansas City Woodworkers Guild. These lumbers have been treated with chemicals that may have negative health consequences. Before starting, adjust the planer to a thickness that allows the boards that you are going to be planing to pass easily under the cutting head without removing any more than 1/32 to 1/16 of an inch of material. Always run wood through the planer with the grain running parallel to the length of the planer bed. Never plane across the grain or across an in-grain slab. This will almost certainly cause tear out, and it may happen in an explosive manner by damaging the planer and possibly injuring the operator. While planer kickbacks are rare, they are potentially violent. When feeding stock into the planer, always stand to the left or right of the feed table to be clear of any kickback should it happen. Extremely dry or brittle wood also has the potential to shatter and be ejected from the infeed side of the planer. If the board is thicker on one end than the other and jams in the machine, do not shut it off. Slowly crank open the height adjustment wheel until the board resumes feeding through the planer. Should the machine lock up and trip the circuit breaker, crank open the feed table until you can clear the jam and then immediately notify the foreman so that they can reset the breaker and you can resume working. If you need to plane any stock that is equal to or less than 3/8 of an inch thick, you must use a backer board. If the stock to be planed is equal to or less than 1/4 of an inch thick, it is too thin to be fed through any of our planers and must be hand planed or may possibly be fed through a wide belt or edge sander. As you feed stock into the planer, be careful not to get your fingers pinched in between the stock and the in-feed table. The downward pressure of the feed rollers on the stock presents as a substantial crush injury risk. Keep your hands, fingers, and any other body parts more than 3 inches away from the in-feed ports of the machine at all times. It is acceptable to have a helper catch your material as it exits the planer. He or she should place the boards on top of the planer's return rollers or stack the material on a cart and nearby table. If the planer's attached dust collector has a warning light and it begins flashing while you are planing, shut down your operation and the dust collector and remove and empty the dust barrel attached to the collector. Again, if you're not sure how to do this, ask your foreman for some assistance and you'll be a pro before you know it. When finished, shut down the planer and then the dust collector. However, if your planer is sharing its dust collector with another machine, make sure that another member isn't using the shared machines. If so, leave the dust collector running so that they can safely complete their operation. Check around your work area for dust and debris. Clean up both the machine and the adjacent floor area. Please remember, be alert and always be safe. For the Kansas City Woodworkers Guild, this is Christine Kessler. Thanks for watching.
Kitsy Dingley, and welcome to another episode of the Kansas City Woodworkers Guild ongoing series of machine safety videos. Today's video will introduce you to the safety concerns of the ShopFox 15-inch wide belt sander. Keep in mind that like all safety videos, this video only covers the safety concerns of the ShopFox wide belt sander and is not a complete training program for the use of this sander. When in the shop, please direct any questions about using this or any other machine to the shop foreman. He or she is there as your main resource to keep you safe and provide assistance in completing your project successfully. And always remember, the most important of safety concerns is to wear approved safety glasses with side shields at all times while in our shop. The wide belt sander is for sanding any wide, flat panels on your project. The ShopFox sander uses a 15-inch wide sanding belt. This sander also has an open-end design so that you could sand panels wider than 15 inches. However, this practice is not encouraged because our shop has other wide belt sanders capable of sanding panels up to 37 inches in one pass. To ensure that your stock contacts the feed rollers, the minimum length of any stock being fed into the ShopFox sander is 14 inches, and the minimum thickness is 3/16 of an inch. Sanding stock to a thickness that is less than 3/16 of an inch is possible, but to prevent damage to the machine and your project, you must use a backer board. There are no in-feed and out-feed tables on any of our wide belt sanders, so that you must make sure that the area is clear on both the in-feed and the out-feed sides of the table. The control panel consists of the following: power indicator light, feed table on and off buttons, sanding belt on and off buttons, and an emergency stop button. Note also the emergency stop panic bar at the end of the in-feed side of the feed belt table. Emergency stop buttons and bars are for the immediate stopping of the machine, as in case of an emergency. Do not use them in the regular process of shutting down the machine, as the process is abrupt and it's hard on the machine. To get started, turn on the air supply to the sander, start the dust collector, adjust the table height to material thickness, raising the table until the stock has resistance sliding under the pressure roller. Turn on the feed belt, turn on the sanding belt. Be careful not to allow your fingers or clothing to get pinned between the board and the feed belt. Feed pieces individually through the sander. Do not feed multiple pieces through at the same time to prevent kickback of one or more.
All right, everyone, we're back. I've got a couple quick announcements before we get into show and tell. One, I was reminded that this Saturday is the Woodcraft parking lot sale, the used tools in the parking lot. So if you want to go to Woodcraft, that might be something good for that. I'm not sure exactly what time, but you all can check it out. And the other thing I forgot to mention, this is our first meeting where our signs are up. So don't they look great? The signs look awesome outside. And thank you to our sign committee. A lot of good work by everybody. And you can check it out when you're leaving. The lights are on. So appreciate that. So now we're going to finish up with show and tell tonight. If you've got show and tell, you can go ahead and head over there. And then Jim, come on up and lead the way, my friend.
So I just came back from a trip from Australia, and I went to Perth this time. I'd never been to Western Australia before. And there's a wood over there called sandalwood, and it's much like what's the wood in Texas they use? Mesquite. It's a lighter color than mesquite, but they look like mesquite trees growing. And what they do with this stuff is they boil it in big vats, and they get the oil out of it. And they make all kinds of cosmetics and things of that nature out of the oil of that thing. So the manager of this place was in a place called Albany, way down in the southwest corner of Australia. And the manager of this place was showing me around, and he says, well, I got something else in the back I want to show you. And he had a still back there, and he was making alcohol out of that. He says, you want to try some? And I said, well, sure, I'll take a sip. And I've tasted battery acid that tastes better than that. He had a fruit a mason jar about this big. It was full, and he goes, and I just walked away and I said, I have never seen anything like that before. How do you grow these trees? He said they got to grow in the desert. But it was really an interesting day. The other thing, they had a showroom there, and I was looking at the wood grain on the floor. And I said, this is really unique. And what kind of wood is this? And he goes, it's plastic. And I felt like crawling underneath concrete about that time. So, looks like we got an abundance of show and tell. Nobody must have been doing anything this month, huh? Anyway, who wants to come up first? Okay, so put them down on here.
Just a...
Here, take this.
Okay.
Hold it up tight.
Just some simple earrings, quick project I did on the laser.
Okay, and this is a multiple piece of dice?
Yes.
What's the number signify on that? Oh. Great. Okay, so what's the numbers on these?
Critical hit and critical failure in Dungeons & Dragons. The highest number you can roll and the lowest.
Okay. What's the significance of these particular ones?
My mother and her sister were born on Dia de los Muertos, and I made these in memory of her.
Okay, and you said
Dia de los Muertos.
And what is that?
The Day of the Dead in Mexico.
Okay.
They celebrate with sugar skulls. Okay. Little skulls made with sugar and decorated and colorful.
And these
here? These are actually in the logo for Dungeons and Dragons. It's the and symbol is D-and-D. So little dragon and.
And these here?
Also sugar skulls.
Okay. And the last ones?
The Great Lord Cthulhu.
Who's he?
A fictional elder god made up in the 20s by Lovecraft, Howard Phillips Lovecraft. And it's remained popular since then,
You're not into,
among nerds.
You're not into Dungeons and Dragons, are you?
A little bit, yeah.
I can tell. So you did these all on the laser burner?
Yeah, just from some scrap cherry I had laying around.
Awesome. Is your intent to sell these?
I have sold. I sold a set of these, a couple sets of these. Haven't sold any of these. Nobody knows what they are except me. And a couple other designs I had that I sold out of. I sold those last month at First Fridays.
Okay. Awesome. So I hope everybody gets a chance to see these before we leave today, because usually we get to see this stuff during the break. Anybody got any questions about this stuff? Scott?
Yeah, what was runtime on one of those? Obviously, the more intricate.
This one, for a pair of them, 5 minutes. Yeah, it cuts through, cherry very beautifully, and it cuts it, pretty quickly. The engraving takes longer, especially this type of engraving, the offset line engraving.
So it was 5 minutes altogether. How long have you been doing it?
Sorry.
How long you been engraving with your laser, and how long was the programming time to do one of those?
Not very long at all. I've gotten pretty good with the program. Yeah, I just find the images online, convert them, and yeah, little tweaks going along, but these didn't take very much design work at all. They were a really quick project.
Any other questions? You gotta get up close to these to see the detail on them. So before you leave, you know, it would be good. Put them back up here. So it's good. It'd be better if you got a piece of white background to lay them on. Show up a little bit better.
Okay, I'll get a piece of paper to put them on so
Okay.
they can show up a little bit better.
All right.
All right.
Thanks. Good job. Next.
Well, as long as we're talking about lasers, I thought I'd bring mine up here.
Got to put this up.
I thought I'd bring mine up here. This is done on Baltic birch, 3 layers, downloaded from Google Maps, a map of Table Rock Lake, and I tried to cut it through where you could see the lake, and I was going to paint the bottom layer blue, but I got impatient. I couldn't get it to go all the way through that middle layer, so I just kind of let it be as it was, and I used Odie's oil on it, and next time
Awesome. Love it.
Next time, though, I got to put. I'm going to do still another coat, because you can see up here in the corners where I didn't get the Odie's oil in it, and you can still see that. I'm going to go back and fix that. Anyway, then I burned all this. You know, the roads. It's all burned, but it wasn't great. So I took some paint, touch-up paint, and black, and I painted it black.
So this is
Black.
the area, this relief black area is the area that.
Those are roads that are on the map.
Okay, and that wasn't burnt. That's what you left, right?
No, but yeah, it was, all this stuff was burned, and I popped out these things, and you can see this one right here.
Oh, I
I
see.
couldn't get it to pop out, so I just let it be.
Okay.
But it was
did it take?
tricky because I broke one of them, and I had to get some glue and fix it. You know, just
So
next time I'm going to do Table Rock Lake. That's nicer lake.
Okay.
So how long did this take you? Oh, too long. I mean, it was a learning curve. It took once I got the mapping downloaded and the file through the separated and all that. The first layer, 30 seconds, you know, to cut, but it took forever to, you know. The third layer, there were 3 layers, and it just, all together, I think it took about 4 or 5 hours.
Okay.
Well, yeah, for the whole
All right.
project, you know.
So, and how long did it take, the data processing take?
I know you get the files right. That's what took about an hour, I'd say.
Okay.
But you know, that's what you do at home when you're bored. You just go up and sit on your computer and you just play. Now this might be more interesting. This is a cell phone stand that I'm putting it on, right, for displaying, and that's pretty cool. This was done old school. But I did cut it out I lasered out.
You mean you actually used the woodworking tool?
Man, I did. I used the bandsaw, and I used the drill press, and I used the sander. I mean, I old school this thing, but but I tell you what, next time I'm going to do it again. I'm going to do it differently, okay? But this, you see where I tried to engrave my name on it? I engraved it. I got the name right, and it looked pretty good. I thought, well, I'll fill it in. You know, I'll just come back. I didn't move it or anything when it was on the bed back there. And I said, I'll just go back and burn it in, and it didn't work. I should have left it alone and just had my name engraved with just the outline. But oh well, it worked. Yeah, I mean, so I don't want to do this. I guess it uses a cell phone. I'm in a cell phone holder. It works great as a cell phone holder.
Okay.
Easy pattern.
Questions about this?
Well, let me put this back, the whole project.
Did you use a CNC machine here, or you have your own? Or?
No, I didn't use a CNC. I mean, technically, a laser engraver is a CNC.
Oh, I'm sorry.
Technically,
Yeah,
it is because it has an X and a Y off axis, but a CNC actually uses a router.
Okay, yeah,
and carves it out, and that's my next big step in life. I'm gonna get pretty good at this, and then I'm gonna convert to the CNC. But no, I use the one back here. The one back here is a good one. It's a what's called a CO2 laser, as opposed to a diode laser. A diode laser's, it's much slower and much cheaper. You can buy a diode laser and do it at home probably for like $1,000, and that's what a lot of people do. But these back here, the CO2 lasers start getting real expensive when you start looking at those machines.
Okay, any other questions? Thanks for bringing that in.
Can I remind everyone, if you're speaking, we need the mic up close to your mouth, because we can all hear it here, but the viewers at home, they can't hear. So just when you have the mic, bring it on up to your mouth. So appreciate that.
The farther away the mic is, the more static we get.
It's about this, Gary, Greg?
Greg, I've been carving spoons a long time, and so the way I do it is I'll actually cut this out and glue it to the wood with a glue stick, like you would use to glue paper together. And
You're talking about gluing the paper on the wood.
glue the paper
Okay.
onto the wood, and then I put it in the vise and actually cut the bowl out,
What do you use for that?
just gouges mostly.
Okay.
But the reason I brought it in tonight, I've carved walnut and maple and cherry, mesquite. This is pear wood. I've never carved pear wood before, and it's the best carving wood I've ever found. It's better than basswood. It's better than anything. It's really hard. It's maybe almost as hard as maple, but it's really fun to work because it's such fine grain. I think it's a wood that we're all overlooking. And there are a million Bradford pears around, and this came from a branch that I helped a friend of mine take out a pear tree they didn't want anymore.
So it was a Bradford pear?
Theirs was an ornamental, but from what I've read, all pear wood's about the same.
Have you ever tried Swiss pear?
No.
It's an exotic wood from Europe, basically. There's a little bit of it here. It's a lot oranger.
Oh.
It has an orange tinge to it, and it's the same. It's really, really good carving wood.
I was just amazed. I like cherry to carve. This is better. It's the nicest wood to carve I've come across.
How many of these have you made?
Oh, heavens, I don't know. I give them away as fast as I make them, it seems like.
Really?
I mean, I got half a dozen
this
at
one?
home. That one's going to go home with me, and I'm going to use it to cook with.
Oh, okay. Shoot.
It stirs chili real good.
So, okay, you used a gouge to clean out the bowl.
Right. And then I take it to the bandsaw and follow my pattern and rough it out on the bandsaw. And I'll flip it up on the side and glue this to the side and then rough it out from the side on the bandsaw again. And just use that paper glue stick to glue it all down. Makes it.
Okay, and then how do you get the round handle part?
Oh, I did all that with
Rasp?
No, I did a lot of it with carving knife.
Okay.
But I do use a rasp to help clean things up.
Do you put a finish on this?
It's got an oil, mineral oil and beeswax that I put on it. And
Try Odie's oil.
you can't eat it.
Yes, you can. It's
Oh,
edible.
okay. I didn't know
Yeah.
that. Anyway, the beeswax and the mineral oil works pretty well for me.
Okay.
And then after I washed it a time or two, I'll put a little canola oil on it. Seems to work.
Yeah, but there's a problem with vegetable base oils.
Canola doesn't seem to get rancid.
Really?
Yeah,
Okay.
that's been my experience, and I got one that's 10 years old, so.
Good. Any questions? John?
Just curious if you've tried a draw knife on any of those.
I haven't. I've got one of those knives that's curved on the end. I don't even know.
Like a hook knife.
Hook knife,
But
yes.
for the handle part, or what are you using?
I sometimes use that to finish up the bowl.
But for the handle part,
For the handle part, I just use a carving knife for
Okay.
almost all of it.
like a Sloyd knife.
Yes.
You know, if you've got a number of these, you could probably bring it up to First Friday.
As slow as I make them, I never make any money that way.
Okay. Well, if you're intent on giving them away.
Yeah. Okay.
Any other questions?
How is it the canola oil keeps it from, I mean, it's edible canola oil, right?
Yeah.
So I guess that's the type of oil that you use to,
I start off with the mineral oil and
Yeah.
beeswax, but then
Mineral
after
oil.
I've washed it 2 or 3 times, I've got the canola oil right there because I use it when I'm cooking.
the same kind of canola oil you cook with, yeah?
Same
And you
kind.
just put it on there, okay.
And I put it on then and rub it in a little bit, and
So that'd work on cutting boards as well, right?
Yeah.
No.
No?
Definitely not.
No. Well, I'll ask you then, what about that Odie's oil? That'll work on cutting
Yeah,
boards?
Odie's oil is basically,
It's good stuff. I
It's
know,
got a
yeah.
wax base and tongue oil.
Yeah.
And it is edible. The base oil, though, that everybody uses for cutting boards and any type of wood that is exposed to food is mineral oil. But mineral oil has a tendency to dry out, so.
So that's why you're putting the canola oil on after the mineral.
afterwards. And
Yeah.
because of the spoons, they get washed fairly frequently. I
dried
think
out,
that's
yeah.
one of the reasons it doesn't get rancid.
Okay. Have you worked with what's called Acacia wood?
I have.
Yeah. Well, how does that pair compared with Acacia wood?
I think the pear is almost as hard as maple. I mean, it's really close, and I've been really fascinated with it because you can get such detail work with it because of the fine grain. It's a neat
Well,
wood.
isn't it harder to carve than like basswood or?
It is, but again, I'm not doing it to try and make any money at it. I'm just doing it for fun, and I like to make things that'll last a long time. So the other thing is, every master gardener in town will tell you to go cut down your Bradford pears, and if you start doing that, you ought to save some of that wood, because I didn't save near enough from the one I took out.
I'm sure you're going to be able to find more.
I think so too.
Okay, any other questions? Thanks for doing that. Nice job, Greg. You're next. And this is what do you call it?
Dice tower.
A dice counter?
Dice tower.
Okay. You got any dice?
Unfortunately, no.
Okay. So what happens put your dice in the top here, and they automatically mix up, and they go down in here, and however what shows up is what you count?
Yeah, that's actually like exactly what happens.
Okay.
So.
And you made this out of cherry?
Yep, all of this is cherry, and then the accents here are walnut.
Okay. And what kind of finish did you put on this?
Just some lacquer on it.
Okay. Spray can lacquer?
Yeah.
Okay.
Eventually, I was gonna put something different on it. This was this finish was just for I need to put something on it to get a grade because this was my final project for my woodshop class.
Okay, so this is your high school class?
Yes.
Where did you get the idea to build a dice machine?
I'm actually in a D&D group, and one of my friends has been complaining that they don't have one and they need one. So
Okay.
I just built this for them.
You're in high school?
Up until Friday.
You're graduating on Friday.
Yep.
Congratulations. So you play a lot of games with, have you used this?
Not this one exactly.
Okay.
I've used a different one, but eventually I am going to use this one. I'm not sure when.
Okay.
But yeah, my main hope is to get some good use out of it.
Okay. You ever think about producing these for sale?
Actually, that's actually a good idea. I might actually do that.
I need a commission on this. Okay. So basically what happens is there any a minimum or a maximum number of dice that you can use?
There's I believe 8 in one dice set. It's recommended to put 4 dice in at a time.
Okay.
If you put too many.
Okay. Oh. Okay, there we go.
If you put too many dice in here, it's a possibility that the dice might get stuck.
Oh, okay.
So, and you really don't want that.
Okay, so do they make them bigger that you can use more dice in?
Probably.
Okay.
I could probably make this a lot bigger.
Why don't you research that and bring another one in next month?
I'm not sure about next month, but.
Okay. Any questions about this? Yes, sir.
The corner joints, is that glue or is there any kind of mechanical interlock between the walnut and the cherry?
Are these just butted together, or do you have some kind of a joint in there?
I just basically put them in there. I don't really have any joints in there. Didn't really have the tools to actually do that at my school, unfortunately. But yeah, it's working, so.
So the dice go in here and they change direction 3 times.
Yes.
Okay.
There's a ramp. Yeah, there's a ramp here, going this way. A ramp here, going the other direction, and one more ramp down here, and then at the bottom there's a ramp
So there's 4. Okay.
Yeah. Yes.
Awesome. Any other questions? Awesome job. Thanks for doing that.
Thank you.
Is there any more?
Well, one more, Jim. Happy birthday from all of us.
Thank you.
Well, I think that's it for the evening. Thank you all for coming on out. I think we had a great meeting. Thank you again, Katherine, for a great presentation, and thanks everybody for the show and tell. That's always great to see good work. Y'all have be safe. Obviously, feel free to hang out. Also, help us clean up, put the chairs away, set the shop back up. We'd appreciate the help. Thanks, everyone. Have a good evening.
A special thank you to our guest today, to the Guild's Leadership Committee, and to all of our sponsors. For more information about the Guild, upcoming classes, and events, please visit our website kcwg.org. You can also find us on social media by searching for Kansas City Woodworkers Guild. And remember to hit the subscribe button and ring the bell for notifications.